Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase our microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serums, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to talk about a pretty fascinating technology in the scientific world that I have yet discussed on my channel. This technology is called CRISPR Cas9, and in a nutshell, it is a two-component genome editing technology that's been around for nearly a decade. It's had a massive impact and practicality in the world in a lot of areas, including places like medicine, agriculture, and bioenergy. And the incredible and optimistic thing about CRISPR is that I strongly feel that this is the direction that the future is headed towards. For example, CRISPR in agricultural purposes have been used to, genetically modify food to improve nutritional value, increase their shelf life, and even make them pest resistant. CRISPR can also genetically modify plants so that they can survive in rough conditions. And it's been used to experiment with gene-edited mosquitoes to reduce the spread of malaria. And from a medical standpoint, the possibilities I feel are just like endless. Since CRISPR can theoretically be used to correct mutations at the DNA level, people, especially with genetic disorders, things like with cancer and even hair loss, which will obviously be the main focus for today's video, have been experimented with, and with some of these treatments that were performed, it's shown to have very promising and therapeutic results. One of the more promising treatments and research currently being developed involves the use of CRISPR Cas9 to basically target these multiple cancer-specific mutations through cancer-specific insertions and deletions attackers to selectively induce cancer cell death without affecting the surrounding normal cells. And if this is successful, this would lead to better treatment options, and hopefully later down the road, it's gonna bring up a cure for things like lung cancer, pancreatic cancer, stomach cancer, all these diseases that claim hundreds of thousands of lives every year. The possibilities, I feel, are just truly endless in what CRISPR can offer. So let's go ahead and dive into the mechanism of action of how CRISPR Cas9 works. And then I'm going to be talking about a Korean company that is utilizing this technology in the hopes of treating androgenic alopecia. So CRISPR is the acronym for Clustered Regularly Interspaced Short Palindromic Repeats, and it is a unique technology that enables geneticists and doctors and medical researchers to edit part of the genome by removing, adding, or editing sections of the DNA sequence. Its origin lies in the natural adaptive immunity of bacteria, and it's currently the simplest, the most versatile, and precise method of genetic manipulation, and therefore this has been causing quite a buzz in the scientific world for the past decade. So CRISPR Cas9 system is composed of two key molecules. The first one is an enzyme called Cas9. And what this does is that it acts as a pair of molecular scissors that can cut the two strands of DNA at a specific and precise target location in the genome so that bits of DNA can either be added or removed. And then a piece of RNA called the guide RNA consists of a small piece of pre-designed RNA sequence, 20 bases long, located within a longer RNA scaffold. And this scaffold part binds to DNA, and this pre-designed sequence guides the Cas9 enzyme to the right part of the genome that eventually needs to be manipulated. This makes sure that Cas9 enzyme cuts at the right point of the genome. The guide RNA is designed to basically find and bind to a specific target sequence in the DNA. So, for example, someone with something like sickle cell disease would need to have a key location in the hemoglobin gene replaced. The guide RNA has RNA bases that are basically complementary to those of the target DNA sequence in the genome. And theoretically, the guide RNA will only bind to the target sequence and no other regions of the genome. Once Cas9 enzyme binds at the target sequence through the help of guide RNA, it generates double-stranded DNA breaks or scissors to activate cellular DNA repair pathways for genome editing. Now that we kind of have like a basic understanding of what the mechanism of action for CRISPR Cas9 is, there's actually a company in South Korea called Mujin Medi that is in the works of utilizing CRISPR-based gene editing technology to treat androgenic alopecia. They have developed this thing known as an ultrasound microbubble nanoliposomal delivery system to allow gene editing particles directly into the dermal papilla cells of the hair follicles. There are previous studies that have demonstrated that the use of these ultrasounds with microbubbles can actually effectively increase cell membrane permeability, resulting in enhanced tissue distribution and intracellular drug delivery molecules, nanoparticles, and other therapeutic agents. So using CRISPR Cas9, guide RNA is created to target the SRD5A2 gene, which is responsible for creating the 5-alpha reductase enzyme, which we know is going to play a pivotal role in the conversion of testosterone into DHT. The combination of Cas9 and guide RNA, which is specifically designed to suppress the SRD5A2 gene, is then encapsulated into nanoliposomes, which are attached to microbubbles within a topical solution, which is then applied on the scalp. And then an ultrasound at a specific frequency is then going to be applied to the skin, which bursts the microbubbles and creates momentary cavities in the surface of the skin to transport these nanoliposomes through the epidermis and then eventually to the dermal papilla cells. Cas9 is then going to cut into the target RNA and allows a crafted guide RNA sequence to suppress the 5AR gene within the dermal papilla, preventing the hair follicle cells from activating the 5-alpha reductase enzyme. So this actually sounds very similar in terms of mechanism of action to that of the drug finasteride, which also blocks 5AR enzyme from converting testosterone to DHT. But because Mugene isn't utilizing finasteride to inhibit the 5AR enzyme, it's theoretically not supposed to induce any adverse side effects that come from taking oral or topical finasteride, which is both known to go systemic at varying levels. Finasteride also is not going to inhibit 100% of conversion of testosterone to DHT, so there are still going to be scalp and serum DH levels circulating in the system. But if CRISPR Cas9 is indeed successfully applied, this means that there should be a 100% suppression of the 5AR gene, basically making you 5-alpha reductase deficient on the scalp. And based on some of the studies that we do know about individuals who are genetically 5-alpha reductase deficient due to, the mutation in the SRD5A2 gene, they actually never developed androgenetic alopecia. So if you think about this, this really wouldn't be a cure to hair loss per se, but if this treatment is indeed successful, people who are experiencing the first onset of hair loss, or even those who have a genetic predisposition of androgenetic alopecia and want to prevent it, can use this treatment to prevent hair loss caused by DHT. And I feel like this would be a huge game changer for those who can prevent further progression of hair loss, all without having to intervene with drugs that can actually mess around with your hormonal profile. I will say that this treatment may not work for those who are still going to be sensitive to other endogenous androgens like testosterone. That is still going to be produced in the body, since you're not really altering or changing the amount of androgens like testosterone that are still being produced. Basically, what this is doing is it's simply suppressing the 5-alpha reductase gene itself and not really regulating any of the androgen levels. Now, the company is also looking for various partnerships to incorporate their ultrasound microbubble technology in conjunction with other hair loss treatment medications such as finasteride, topical finasteride, or dutasteride, or even other medications for better efficacy, as it theoretically can be delivered more effectively into the dermal papilla cell region of the hair follicle directly. For example, we know that topical minoxidil is something that is very poorly absorbed. Like the majority of it's actually just wasted on, on your hair. This technology has the potential to deliver certain drugs into specific target areas such as the dermal papilla cells in the hair follicle for maximum and direct efficacy. And if a company like Japan, can actually intervene, their fast-track FDA approval pathway can certainly help speed up the process in commercialization if everything goes as planned. But so far, based on my research that I've done on the company and also on CRISPR Cas9, they don't know exactly how many applications or the frequency that will be required. It's definitely going to have to be an in-office procedure. There's no indication on the cost that I could, that I was able to find. But I would assume something like this would have to be affordable for the average Joe. This research on their CRISPR Cas9 ultrasound activated microbubble nanoliposomal delivery technology was published in February 2020, and this is still preliminary, and we still don't have any updates from the company as far as their pipeline. So I'm still assuming that they're still very in the beginning stages, and they're still sorting out the bits and pieces. And the more important thing is that if they can move forward with their toxicity clinical study proving that CRISPR Cas9 is not going to migrate to different areas or go off target locations in the body, I can foresee that this treatment moving forward to human clinical trials in the next few years. But this, according to the company, is their biggest hurdle that they have yet to overcome. And hopefully they will be able to show that it not only treats the intended target areas, but it's also efficacious. So I will definitely keep you guys updated once I hear back from them. But yeah, in theory, it sounds incredible. This is a technology that can potentially revolutionize the hair loss industry. But just like a lot of these treatments, there are going to be downfalls, limitations, and concerns when it comes to CRISPR. Not just for hair loss, but CRISPR technology in general. I think one of the greatest risks that the company has mentioned, and also what I strongly believe is one of the big risk potential, are basically off-target effects, basically unattended cleavage and mutations at these untargeted genomic sites, showing a similar but not an identical sequence compared to the intended target site, is something that scientists still yet have not fully figured out. Not being able to control this can cause further mutations on other non-specific areas in the body. And then you can run into things like potential cancer risks, and this could affect a crucial gene or another important part of the genome, causing specific DNA mutations and side effects. And the thing is that a lot of these long-term side effects and risks are still unknown. In the case that this happens, there currently is no post-exposure prophylactic medication or other strategies available to prevent or undo an untoward CRISPR-Cas9 target nuclear material change. But the good thing is that we do, however, have other CRISPR method technologies that can basically control these gene expressions while leaving underlying DNA sequence unchanged, similar to kind of like using like an on and off switch. So if that's the case with Moogene, this would also be a huge game changer and also a big milestone as far as achieving something that no other company has done for treating hair loss without actually altering the DNA sequence. If we can also incorporate the same technology in shutting off, let's say like the androgen receptors in tissue-specific areas like on the scalp, I think this would by far be more a efficacious treatment and preventive treatment in my opinion. So I think the possibility with like CRISPR Cas9 is just endless, and I would definitely love to see either Moogene or some other company moving forward towards in this direction that can basically shut off the androgen receptors on the scalp. I did read about a few clinical studies that can actually do this, particularly in prostate cancer, where scientists were able to cleave the AR gene in specific target areas in vitro. So this is looking pretty promising in the near future to see at the very least. I still feel like we are a bit far out in terms of using this technology for treating hair loss and in medicine in general, but there is definitely a lot of concerns about long-term safety. But eventually, I feel like the reality is that this is the future for hair loss treatments, something that is theoretically able to work. And it can be a huge milestone, like I said, in the field of medicine and other realms all across the board. Being able to genetically modify specific genes within our DNA to target and treat hair loss sounds incredible. And it's by far one of my favorite topics and research. And I think this is so much better than, stem cell multiplication. And every time I hear about these companies, that are willing to move forward with, CRISPR Cas9, I get very excited. And so I will try to email the company because they are Korean, and hopefully there can be some type of, connection there about the research and kind of like what stages that they're at. And hopefully if I'm able to do some interviews with them, that'd be incredible. But I will keep you guys posted on that if I hear back. But that pretty much wrapped up the video, guys. Let me know in the comments what you think about this treatment, CRISPR Cas9. Thanks for watching, guys, and I will talk to you guys in my next video. Take care.